So, first of all, I would like to welcome everybody again. My name is Bartek Bernat. I'm going to say words about me in a moment. However, all the questions that you may have during this webinar, you're welcome to ask using Q&A section. Please don't use chat, use Q&A. That help us a lot here. So when it comes to this last section of this webinar, almost the last one, I will try to answer as many as I can. Yeah, so I believe it's a good time to start. Okay. Good. So yeah, I'm going to start from the About Me slide again. So my name is Bartek Bernat. I was working in a Preshape in the past in Denmark for over 5 years. I'm the IT engineer, also a dental technician. So it's a pleasure for me to host this webinar again for you. So as you can see on the screen, there are some history photos with my team and also some very old pods for TRIOS 2. As I started, TRIOS was just at the very beginning. It was not even have a name TRIOS 1, just TRIOS. So, yep. So basically, let's go to some agenda for today's webinar. So I'm going to talk about more complex stuff than before. It's not going to be basic anymore, so we're going to jump straight to the quite difficult part, which is scanning for the implant retain application. I'm going to show you the order form, how to scan for the abutment, what the workflow is looking like. Then we're going to cover some scanning strategies and workflows for partially and fully edentulous applications. This is quite a big one, so prepare for that. And last thing, I'm going to talk about some excitement apps, as Preshape used to call them, which is TRIOS Smile Design, TRIOS Treatment Simulator, and TRIOS Patient Monitoring. And the agenda for this webinar is that I'm going to base this on this presentation. However, I'm going to switch to the TRIOS running in the background here and do some scanning, showing you some information that needs to be shown in the live system. So let's get started. Yes, so I would like to start from scanning from the implant and for the implants. So basically, there's a special workflow for that, obviously, and hopefully you can see my cursor on the screen. Here I have chosen screw retain crown, which is probably probably is going to be a choice. It's very rare people do scanning just for the abutment alone. However, it's also possible. So most of the choices would be you go to the section of the abutment and then choose indication, which is either abutment itself or the screw retain crown. And of course, you do that after you choose the tooth here, and as you can see, you have one in the upper jaw. So as you can also see on the right, this means that the workflow is going to open. It's going to be scanning for the lower jaw, upper jaw. Here are like 2 phases of the scan, and then bite. Okay, so but before we get to that, let's move on here. So once you choose your screw retain crown, you need to do very important choices here. So basically, you need to choose manufacturer, system, connection, and those choices are super important. You need to know what kind of implant is already in a patient mouth, obviously, and then follow this because without this information, your lab wouldn't be able to create your screw retain crown. On top of that, you can choose also the material, shade as usual. If you have a couple of implants, you can choose to put them in group. That's the information for the lab to have a same insertion direction. Obviously, for single, it doesn't really matter. As you can see here on the right of the screen, there is the emergence profile enabled. You'll see it in a moment. However, the thing is that it is enabled by default. And I would strongly recommend you to leave it like that. Do not disable that, because the emergence profile phase here is very important for the good scan. So basically, over here for the upper jaw case, you're going to scan upper jaw emergence profile. Then you will scan the scan flag itself. As you can see here, this scan is available straight on. However, this one can only be done if the previous one is fully completed. We get to that in a moment. So yeah, a bit more information here before you begin to do this. So it's a good idea to train with the pre-preparation scan just for the crown, because it's very similar workflow. So it's also two phases. First, you scan crown before preparation, then you prepare a tooth and scan that. So basically, it looks almost identical, except, of course, the scan flag. So while you do that, you can also memorize the sequence of the processes and the most important kind of consequences for skipping one of them, which could be quite bad. So make sure you have before your scan, and this is really serious stuff, make sure you have the scan flag. Without the scan flag, we cannot scan, obviously, for the implant case. And I saw many cases that people were having problems with that. So make sure you have it in hand. And also the tool to remove the healing abutment, if it's anything special in there, and installing the scan flag, which is normally just a simple, very, very tiny screwdriver, like this one is barely visible. Anyway, so, and also make sure if you're doing multiple restoration points that you have enough scan flags. Of course, it's possible to just use one and move it from place to place, but more convenient is to have the appropriate amount of them. So now it's time for some live demo, and I'm going to switch now to my TRIOS, and we're going to do some scanning for the implant case from the very beginning. Okay. Good. Yes. Okay. So hopefully now on the screen you can see the case as it was scanned. I was doing some preparations here, but we're going to start from the scratch, obviously. So let us make a new case for the patient, Dr. Illos. Okay, first we're going to choose probably our lab in a moment. Yes, this is my lab here. So yeah, I'm just going to choose the 125. This is what I have on my model here. Okay, so once I have chosen that, obviously I need to choose the abutment from the section over here. That's what I'm going to do. Okay, and now by default, this is the last choice. However, you can do some choices here. So if it's really the abutment itself, you could choose the abutment. If it's screw retain, you can stay with the screw retain. Now we're going to choose our manufacturer. You can see there's lots of choices here. I'm going to stick with Noble as I have. Then you need to choose the system here. I have a replace one. Then you need to choose the connection. I have RP in this case. Okay, and now please keep in mind that those choices I've made here about manufacturer, system, and connection are depending on each other. You need to start from the bottom, then it's going to open up all the systems for the Noble, and then you're going to open up all the connections for the replace, obviously. The other choices here is the actual material for our screw retain crown. So I'm going to go with the zirconia with titanium base. Of course, there are lots of choices here. And at this step here, you can choose your shade to inform the lab. and that's a good option. So let me see. It should be something about A3. And obviously you have only one implant, so this choice doesn't really matter, so we keep not in group. Okay, so at this point we are more or less ready to do our scan, and let me show you here. This profile is by default on, and it's very important to keep it on. If you click on that, it's going to be disabled. I don't really recommend that. So because then you're scanning on the scan flag in place, and that could cover our emergence profile itself. So that's why the emergence profile scan is very important. So let's just go and scan. Just now switch to the scanning page. I'm gonna get my scanner. Okay. Okay, so that's going to be very simple scanning on just upper only. So as you can see now, we are in lower. So I'm just going to skip that. I don't even have lower model for this case. So for the purpose of this presentation, we're going to go straight to the upper one. And now I'm just going to use the normal strategy of the scan. First, I'm going to scan as Preshape recommends that to do. So I'm going to start from the almost last molar. This is the upper jaw, so I'm going to go then buccally, and then I'm going to go palatally. So let's just get started. Okay, so I'm going to go buccally here. And palatally. Okay, I'm going to get also some contact points here as well. So I have them. Yep. Good. Okay. So this has been scanned, and now, as you can see, system would like me to actually mark the tooth, and obviously you need to mark somewhere in the middle. That's going to be needed for the next scan that's just been enabled. So it's very important to mark as much as in the middle as possible. As you can see, you have some points that we could scan a bit more. I'm just going to cover that in probably next try. I will show you some a bit of flavor in this scan. So let's just continue. Now we need to mark the tooth, obviously, and put our marking somewhere in here. This blue area is going to be area that's going to be cut out for your scan of your scan flag. So it's kind of important to place it somewhere in the middle. If you need a bit more of the cutout, you can do it manually later on. So now this scan has been enabled over here, and we can switch to that. So let's do it. I'm going to put my scanner back. So at this point, you need to install the scan flag in a patient mouth using the appropriate tool. So this is what I'm going to do. Good. And I'm going to use a screwdriver to secure it in place. Okay, good. As you can see now, we have a nice cutout for our scan flag, right? And at this point, you're only supposed to scan the actual scan flag, nothing else. So if you now kind of discover that you have some missing points here and there, you cannot really do it in this step. It's very important. This is only for the scan flag. So I've mounted in, and now I'm going to focus only on that. So I'm going to start from the occlusal again. Okay, and get a bit buccally, a bit lingually. You just basically need to make sure that the scan flag is firmly connected to the rest of the model, right? It's not floating in the air, basically. And that's basically more than enough. Okay. What I'm going to do now, I'm just going to take it off. So basically at this step, we are more or less done. We are covered our scan flag. So you need to make sure that all of the features of it has been scanned. Like, for example, this structure here. So this is very important for further alignment of the If you have like a holes like that, don't worry about it. We have a structure, we have it connected to the rest of it, more or less family. So this is all good. So this is more than enough to continue with the case. And now, obviously, what we need to do is to scan a lower, to scan a bite, and just continue normally and send the case. So this is basically it. However, as we know, patient is not coming to us with the emergence profile that exposed. So it's probably going to come to us with some healing abutment on. So I'm going to show you how to deal with this, because this could be a bit of a problem. So I'm going to install some sort of the healing abutment here. Okay, so let's just start a new case, and I'm going to do it a bit more realistic. Okay, so let's just do one more case here. You'll see again how I'm doing this. New case. Okay, select the lab, select our tooth, select abutment. Now all the choices have been made, so I need to only do what is missing, and that was only that, and the colors, and I'm gonna go straight to scan. So now the only difference is I now have healing abutment on. This is how patients are coming to the clinic normally. So we have like now two choices. You can either scan healing abutment as is and focus on all of the contact points and then trim it manually. Or you can remove it, then scan quickly before the gingiva collapses and use the lock feature to lock it. I will show you two versions of it. So first, we're gonna scan with the healing abutment on. Let me go to the upper as I should. Okay, this is the same scan here, nothing special. So as you can see now, healing abutment on. Let's call it healing abutment. Okay, I'm going to scan with that. Now I'm going to focus on all of the contact points I need. Take my time because now gingiva cannot collapse just yet. So scan what I can. Okay. And now, before I do any markings, I'm just going to do trimming. Use the normal trim tool, maybe 2 millimeters, and trim this thing away with a bit of excess, right? Just slightly. Normally, of course, healing abutment is covering this profile, so I'm just going to cover this as well. Okay, say done. And now we need to remove healing abutment, obviously. And now you can obviously remove it from the patient mouth and now scan quickly the actual emergence profile, right? So this is the one way to do it. The other way to do it is to start from this as I'm doing now. And if you now want to cover more of the contact points or something else, you can use the lock surface feature, which is over here. And now, whatever you paint here with this tool, I'm gonna paint it white, will never gonna change. So now, if you scan your profile, now you can lock it, okay, say done. And now you can slowly continue if you have something missing, like if you miss some contact points, something like that, if there's something that you really need to focus on. Now, even if the situation is going to change, it's not going to change in a scan because you have locked that. So this is more realistic approach, I would say, to this thing. So yeah, healing abutment shouldn't be a problem. Either scan with it and use the trim function, or remove it, scan your emergence profile quickly, and use a lock function. The same effect. Okay, let's just switch to the next topic. Okay. Good. So now the next topic is dentures. Dentures. So we're going to start from the partial denture. However, there's not much to cover here because there's no special workflow, not special strategy for the scan of the partial denture. So basically, you need to follow the same rules as you're following for the full jaw scan. However, you need to start your scan from the most prominent group of the teeth which are still there, right? To have a good starting point. And that obviously could be some gaps between them. So you need to be careful to transit between them. This is probably the most difficult part, but the rest is pretty much the same. So basically, there is an indication of the removables that is called partial denture, but it's really indicative only. So even if you see on the screen that there are some palatal parts, there are some metal parts, there are some clasps, those are not like choices that you are making at this point. So if you need some clasps in a place that you need them, you need to notify the lab in the comments or maybe attach some drawing how you would like to partial denture to look like, okay? Because there's no special tool to mark clasps or things like that or palatal part just yet. So it's basically full jaw scan. So that leads us to more complex topic, which is the scan for the full denture. Okay, this is when things get more interesting. So there is special strategy for the scan for the edentulous case. Basically, now the section of removables of full denture is not any longer indicative. So you need to choose that to have the right workflow enabled. You can still, of course, scan as a just scan only, but here you have more options. And those options are, you can scan either intraorally, which I'm going to show you. You can scan the impression, that it's more, let's say, traditional approach. You use the impression for the patient to have the right moves, and then you scan that. Or you can scan the denture itself. Of course, the last option is only okay if you have a denture that still fits okay and is kind of, comfortable to use, and the patient can just want to have a copy of it. So yeah, I'm just gonna show you the actual intraoral scanning. Obviously, I will not scan any patient here. I have some nice 3D printed models for that. So let's just get to the actual strategies of this process. So next slide here. So yes, this is the actual strategy. It may look complicated, but don't worry, I'm going to show you that on the Playback scan. And then now we're going to cover it quickly, and I'm going to get to some demos. So as you can see, this is for the comparison, this is the normal scan of the typical jaw. So, and the movements are completely different. So the most important that you need to remember, like a tip, that you need to keep in your live view the area that you're actually scanning. This is normally in the right bottom corner. You need to have the tissue or the ridge that is the most kind of the least moving, so the most stable one. So you're getting mostly the parts that are not moving, and then getting the more flexible parts at the edge of your scanning focus. So you'll get to that in a moment. You'll see that. So yeah, this is the mandible. I'm just going to cover it very, very quickly because I'm just going to show it live. So basically, for the mandible, we are starting in the retromolar area, staying a bit on the lingual aspect of the ridge and proceed towards the midline. Then you continue scanning, moving backwards to the retromolar area and stay on the buccal aspect of the ridge. Then we stop the scanner, so it's a good time to let the patient relax and maybe clean some saliva, which is building up a lot, as we know, in the lower jaw. And then you continue, you're starting your scanning from the midline and proceed towards the retromolar area, staying a bit on the lingual aspect on the ridge, obviously, to get it covered. And then you complete the buccal aspect of the ridge without stopping the scanner. So this is how it goes. Now we go to the upper. I'm going very quickly again, but I'm going to show you this live in a moment. So the maxilla, it's a bit different. We're starting scanning process from the tuberosity area of one side and proceeding along the center of the residual ridge towards the tuberosity area of the opposing side. Then you come back to the midline and complete the scan of the palatal. So this is something new. So you do first the ridge and then the palatal. Very different than the normal full jaw scan. Then you proceed to the buccal aspect of the ridge, and you could split it into the two phases, from one side to the other side, or do it in a one swipe if you have some practice. So yeah, so now I'm going to switch to some live demo of this, and you see what I mean. Okay. Okay, so now we are at our implants again. So let me just go back, and now I'm just going to mark it later. Good. So we're going to search for Mr. Edward. Good. Yeah. So we're going to start from the beginning here. This is what I have scanned already. Yeah, at this point, probably because those models are white, I'm going to switch off the colors so you see a bit more. So you'll see how this scan was looking like. So basically, we're starting obviously from the order here. And as you can see, this is all planned. This is the plan for the full denture. You can see this kind of base here. So you basically need to choose the removable and full denture from here, and then mark any tooth on lower and the upper at the same time, and then you have those bases here. It means that the full denture is activated now. So let's just go to the scan. So since scanning here could be very slow due to the overlay of the Zoom and other applications I have running, so I'm just going to show you this on the so-called Playback. So yeah, so let's just activate this. And by the way, before I do that, you'll see here there is this choice for the intraoral impression and the denture here. So let's just start the playback, and we start from the mandible here. Okay, good. Yep. So it's loading. It's going to be a bit in a slow motion. This is how the playback works, basically. So I have plenty of time to explain it to you. So let's just get started. So I'm going to tell it again. So start scan from the retromolar area, staying a bit on the lingual aspect of the ridge, and then proceed towards the midline, as you can see I'm doing now. Going towards the midline. The whole scan was about 1 minute, so it's going to be a bit slower than that. As you can see, I got a bit problems here on the midline because the models are quite shiny. You can see them here in the live view. So this is this live view that you need to focus mostly on the more stable surfaces. And here I'm continuing scanning, moving backwards to the retromolar area and stay on the buccal aspect of the ridge, obviously. Then once done, I'm going to stop the scanner and then restart scanning in the middle. That's going to happen in a moment. Okay. Yep. Now, as I can see, now I'm just hunting for the good place to start here. Again, a model quite shiny bits, so it's quite hard to do. Okay. Yep. So restarting in the midline, and now we proceed towards the retromolar area, staying a bit on the lingual aspect of the ridge, exactly as I was doing it here. Yep, we went to the very end as far as possible, and then turn into the buccal side, buccal aspect of the ridge. And I'm going to go to the end without stopping the scanner right now. So obviously at this point you need to be aware of any saliva problems, and if it's necessary, it's always better to stop the scanner and then clean the area obviously, and then restart from the same point. It's going to be way easier and faster. So this is how you do that. Okay. Yep. So let's just now go to the upper one. Okay, and I'm going to start the playback again for that. Good. So we're starting our process from the tuberosity area of one side and proceed along the center of the residual ridge towards the tuberosity area of the opposing side. So we basically scan the whole arch at one go. Okay, yep, let me just play it for you. Yep, so this is how I started, somewhere here. Just continue here on the more or less kind of palatal side. Good. Then once done, we're going to come back to the midline. So this is the main difference between the normal teeth jaw. So, and now it's very important that you do some kind of the reverse pendulum move. So you move your scanner more or less like that, and then you cover from the one aspect to the other, fluently cover the whole palatal area. You can see, by the way, nice ridges of my 3D printer here. It's probably not for the dental jobs, but it's good for printing just a model. Okay. So if this is done, then you proceed to the buccal aspect of the ridge, obviously. So I'm finishing off the moves until the end. Yep. And once more or less here, I'm just going to go, I switch to the other side, and now continue obviously to the midline. And as I said, it's possible to either start on the one side and go into the midline and stop the scanner and then start on the other side. Or if you have some experience, you can obviously start, you can do it in one go. So yeah. Okay. We have reached the midline. As I said, this is very slow motion. That this scan was about 1 minute 13 seconds in total. Okay, and this is more or less from the other side. Okay, let me just stop it at this point. I hope it's clear enough. Good. And now, of course, questions could be how to do the bites, right? You have, once you have your upper and the lower, if you go to the bite section over here, you have obviously, again, some choices, which is good. And I have chose to use the wax rim. It's not made of wax, it's also 3D printed, but it looks like a wax rim and fits more or less the same over here. So basically what you need to do is to scan it as a normal bite from each side. This is, for example, the right side. As you can see, this is part of this wax rim, and this is the bite number 2. I scan it from the other side. And obviously, it's sometimes necessary to cut a bit of the stuff of the wax from this side to have some of the ridges visible, because you need to have something to align to, right? So this is one of the options. The other options you are able to choose over here is that you can do the normal bite, classic bite, and scan that manually with the scanner, like 360 around, and try to align to that. So I must say this part requires a bit of practice, as all of the full denture scan. So it's probably not the first thing that you should do with your scanner, but we are here on the advanced level, so probably it's a good place to start anyway. So yeah, so this is more or less about the dentures. I hope there's going to be some questions, because so please ask them in the Q&A. Let me just now switch to my presentation, and we're going to continue with the rest of the things. Okay, good. This is our maxilla again. Yeah. So now I'm going to tell you something about the Excitement app, right? I have prepared 3, even 4 different cases for you. So right now, I'm just going to tell you about it very, very quickly through 3 slides to avoid switching back and forward. So you have an idea what it's all about. So basically, TRIOS Smile Design is the first Excitement app. The point of that is to take the picture of the patient, and then very, very quickly virtually make the virtual smile that we can present to the patient here and now. So he or she would be able to see the difference and compare before and after. You'll see it in a moment. It's quite impressive and really makes some impact. And this is very often kind of lever for the decision for the patient to go with the some veneers or some ortho. So yep, this is a great tool. The next thing we're going to talk about is the treatment simulator. So that's mainly towards ortho things, obviously. So basically, if you scan the full jaw, now also if you scan some not the full jaw cases, you can include this in your scan, and then you can show the patient how his smile and jaw, upper and lower jaw is going to look like in ideal arch. So, and of course, this may not reflect the real outcome that he or she may expect, but will give some kind of overview how it may look like. And again, it's going to be a good selling point to sell some ortho cases. You'll see some presentation, you'll see some case I have for that in a moment. So the next one and the last one I'm going to show you today is the patient monitoring case. So that's basically enabled by default now. So all of the cases that you're scanning, all of the patient that that you're scanning, if the patient is coming again to you, a system now going to know, obviously, they're the same patient, and now you can put it like a history line and actually compare all of the changes that are happening, and then you can pinpoint some problems to the patient. For example, he or she is grinding some teeth, and this may be a problem, or there are some movements that may require some attention, and it's going to be less expensive to do it now than later. So this is a very, very powerful tool, and also very, very powerful diagnostic tool for all of us. So yeah, so let's just get to it. I'm just going to show you now 3 different cases, and then you will see this live. Okay, so let's just go to our TRIOS. Okay, we still have Mr. Ed here, so I'm going to now look for Smile Design case first. Okay, we're going to skip post-processing. We're not going to send this case anyway. So I'm going to go for Mrs. Smile. Yep. So as you can see, I have something prepared here for you. Okay, this is the Smile Design case. So again, idea is that you only need the patient picture. So let's just go with that. So this is the preparation. First, of course, you need to choose the smile design before, but this is easy. Then you have a couple of choices here. I've chosen to have only smile photo, but if you want, you can have also in retracted situation. It means that you may have a chance to show the patient also the lower teeth, which is quite new. This is the newest update from Preshape. So now you can do lower as well. So basically, if you upload your photo to your system here, first you need to do some alignment. I've done it already. Basically, it's just pinpointing here those points, and normally they are done already for you. All you need to do is to zoom here and there and just make sure you're covering really the line that you want to cover. So just draw on this the actual coverage of our smile, and this looks good. So I just did a bit of the correction here. So once it's done, next is available, and we can go next. So now the first step is just to do some contouring. So you can do like contours first, and again, I've done this a bit for you. So you can obviously manipulate the sizes here everywhere. Also, individual tooth, you can make it symmetrical or not. You can see here, maybe picture is not that symmetrical, so you can disable that and do this to alone, okay, and do this a bit more, okay. So basically, as you can see, you can have different layouts. This is one of the choices. There's plenty of choices here. I just chosen that. That's also Sarah or Ella, lots of them, but just stay with this one. And yep, you can also do some freeforming if you want. This is very rough, obviously, so just correct this a bit. You can copy, mirror some of the stuff. You can also do some measurement to be more realistic and measure something on the patient teeth and then apply it over here. Once you do next, we're just going to see the actual teeth as they should look like. And again, here you have a lot of options. You can choose different shading, different options, right? So if you're happy with the result, you can pick the colors, you can change shade, brightness, everything. Lots of options here. You can even edit the photo like in a Photoshop by the smart. Yeah, probably I would want to see this bit way slightly so it's hidden. And again, this one here, we don't want this anymore. Once you're going to show it to the patient, okay. And now we go next. Okay, and this is now the part that you're showing to the patient. So as you can see, that was very quick and simple. So and now you can show the screen to the patient. If you have moved, for example, you can just go towards him or her and just check the difference, how you may look like. And as I said, it's also possible for the lower teeth as well. And for that, I would, of course, advise you to have a more retracted view for the better view. So, yep. And that basically concludes this. Okay. And at the very end of the case, you can export the photo. Obviously, you can send it to the patient email, you can save it, you can do whatever you want with that. However, this is the presentation only. So of course, you can try to send it to the lab, but this is nothing they can really except visually rely on. That's for the, overall orientation, how patient would love to see the outcome. So yep, let me just go to the next case, which is going to be for the treatment simulator. And for that, I'm going to use scan of myself. Okay. So I scanned myself about a week ago. Okay, so this is my own teeth here. And then for the treatment simulator, we're going to see how my teeth may look like if treated properly. So yep, so basically we're just going to go, of course, you should scan the case normally, but we're going to jump straight to the case. So now the scan is going to be loaded. And now what TRIOS is going to do is going to now figure out where the teeth are. It's going to segment it. And then once done, it's going to generate some of the simulation for us so we can see how the things may look like. Okay. Take some time here. Just look quickly on our Q&A. Okay, I'm gonna answer to that. Good. So yeah. So basically, this is the analyze part. There's only one scan. You see, this is a kind of the match with the next stuff, which is the actual while monitoring. But we have only one scan, so it's really nothing to compare here. Okay. Yeah, running pretty low on the resources here with the zoom and everything on. Okay. Yes, this is still monitoring, but we go to our treatment simulator. I'm going to show you this in the next case. Okay, so our simulation is done. Basically, you can see this is the before and after. So of course we can open the jaw. We can only show upper and the lower. And very powerful stuff is of course animation here, just to see the actual difference, how it may change if I should have some proper auto treatment. Also, we can do this all together. Yep. So this is for upper. It's going to be for lower. I can see I have some crawling here in the lower jaw. So this is how it can look like, right? So this is again a very, very powerful tool you can show to your patient. And also here some changes, obviously. We can of course loop it to see the back and forward, right? Of course, again, this is only the simulation. This is only the overview here. So probably I wouldn't like to have my bite open this way. But again, this is some tools to show how it may look like. Okay, so let's just go to the last part, which is the actual patient monitoring. You saw something about that already in my case. So I'm going to show you some special case with the auto treatment again. Okay, so we have here some patient that was coming to us 5 times. So so we have 5 full jaw scans. And now we can obviously show the patient the changes and the progress of the auto case. So let's just see that. And as I mentioned before, this is something that is normally building up automatically, right? So you don't have to think about that. You have just a patient coming to you regularly, just doing your scans, and then after a few, at least 2, maybe 3 or 4 or 5, like here, you can do everything here just to show him the actual changes. So yeah, analyze. Yeah, we'll just go to their monitoring now. See our animation again, how the things are changing. So just going to select all of them, confirm. Okay. And of course, something that we looking forward is the visualization. So you can pick different periods, for example, on the last 2 periods, then you can see the changes highlighted, how the tooth are moving, or you can choose everything. And just now probably is going to complain that the differences are too big. As you can see, they are huge, right? So we just go to the visualization, and again, we can play this for the patient to see how the treatment is actually going on. So he or she can see that it's going in a good direction. So it's a good excellent tool for showing the changes. As you can see here, it's moving fluently between those stages, right? And again, we can just put it all together while doing this. Yeah, so this is not a simulation now. This is based on the actual scans, right? Okay, we just stop it at this point. I'm just gonna go to the presentation again. I have one more thing to show you. So yes, go here. Good. So we stopped at the monitoring. So basically, I just need to cover one more thing. Obviously, all those things, for if you're scanning the patient a lot, maybe you would like to store it somewhere. So again, I would like to recommend our service of the Xflow, that you can just hook it to yet another lab to your system and send all of the stuff that you need to keep for later, that you need to archive. So we have lots of plans, as you can see here, in the right top corners you can choose from. So depending, of course, how much storage you want to have. And this Xflow portal is then can be accessible, of course, to you, to your lab, to your other assistants, so they can use all of the features and get the scans, load them in, get them out, export, import, compare, all this stuff. So please contact our sales if you need to know more about it. And then that brings me to the question time. Okay, so let me just see now questions and answers. Okay, let's have a question. How do you get the record that you would normally capture with muscle trimming? Yes, so basically, that's a great question. So basically, normally, the stuff that I did scanning intraorally, that's a model, obviously, but I may not be able to get that. So then I would choose the option number 2, which is make a traditional impression, do all the moves that you need to do, and scan the impressions if you want that. Obviously, it's probably need to be case related. So there are some cases that are very easy, that you know that the denture is going to hold anyway, so it's safe to scan intraorally, no problem. But for some cases that this is a bit loose, so I would then recommend to scan the impression to match somehow the analog world and the digital world in a very neat way, because from this point you're doing everything digitally. So yeah, I hope that's just gonna answer your question. So let me know if there's any more questions. Okay, I cannot see anything else. So thank you very much for your attention. Have a great evening, and hopefully see you on one of our next webinars. And the subject, we'll see. We find something interesting for you for sure. Thank you very much. Good night.